Hi, very good morning to all of you. Thank you for coming here and listening to this very important talk today. As you visit many booths in this area today and as you go through the event, you realize that there are many innovations that revolved around AI. And what is good about AI, now we're going to talk about some of the possible challenges that come along with AI innovations. And this specific panel is about mental health. So today we have a very esteemed line of speakers. All of them are very experienced in research, in academia, in industry, in practice, and as clinicians as well that deal every day with mental health. And the topic for today is AI and mental health, and I'm very pleased to invite our speakers to share a little bit about what they do on a daily basis, and then we're going to start with a round of very, very important questions that I've prepared beforehand, and then we're going to end with the last 5 to 10 minutes with some Q&A from the audience as well. So if I may invite Dr. Hari to shortly
Hi,
introduce
thank you, Ginsky. I'm Hariyati. I'm an academic at Institute Jantung Negara University College. I'm psychologist by training. Thank you.
Good morning, everyone. Yeah, thank you, Dr. Ginsky. I'm Dr. Jack. Yeah, from Multimedia University Cyberjaya. I'm a senior lecturer there. So the reason why I joined academia is because I can give back to the society. Yeah. So after 30 years of experience in industry. Yeah. All right. Thank you.
Hi, good morning, everyone. I'm Rina. I am from Women in Tech, and at the same time, I'm a founder of Pistol, a local startup focused in reproductive health. And we do cover mental health nuances, very specific towards the women's health category.
Hi, morning everyone. So my name is John. I'm the head of counseling and also the head of research at a mental health startup, a digital mental health startup called ThoughtFull. What we do is we connect employees to mental health professionals and enable access to mental health, basically mental health solutions. And we are located in the mental well-being space. So I guess my real passion here is to see how exactly AI would fit, not just in my own role, but also in the industry in general. So yeah, excited to be here.
Thank you, our panelists, and they have been very humble. So I'll dig into their background a little bit to give context as to how we're going to tie up mental health and AI together. Dr. John Pinto, head of counseling, head of R&D at Thoughtful, he was trained initially in genetics and molecular biology, and then he went into counseling, Masters of Counseling in OUM, and then he did a PhD in UM. More than 25 years of experience as a counselor, as a teacher, and as a mental health consultant as well. Then we have Rina. Rina Ho was trained in commerce and business, has about 13 years of experience in sales, in marketing, in operations, and as she's described, she is the founding CEO of Pistol. And perhaps after this panel, we can ask her more about what Pistol does in reproductive health. Then we have Dr. Jack, senior lecturer at MMU, as is described. What he did not say is that he had a bachelor's in marketing management in UK, MBA in marketing management, as well as a PhD in business in UM Wales. So more than 30 years of experience as an academician, as a researcher, including in topics such as AI in healthcare, AI in food, mental health, and he was part of the marketing team for one of the few of the largest hospitals in Malaysia, as well as senior executive in 2 financial institutions. Finally, we have Dr. Hariyati, head of research and innovation division at IJN University College, trained bachelor's of psychology in Wisconsin Madison, US, master's and PhD in psychology at University of Surrey in UK. Academician for more than 25 years at IIUM, was the co-founder and chief health psychologist at Naluri Hidup. She is also very actively in the NGO world, in Mercy Malaysia, in Malaysia Diabetes Educators Society, in the Hospice Negeri Sembilan, and the American Psychologists Association. So with this, I hope you are excited to listen to what we can learn today from all these experts over here. Perhaps just to encourage our panelists a little bit and to reduce some of the anxiety, may I invite a round of applause for our esteemed panel speakers. Okay, all good? Okay, so to kick us started with AI and mental health, I'd like to start this question, perhaps starting with Dr. Hari, which is, we've heard a lot about AI, what it can do for us, and inevitably, it is going to impact healthcare. So the question is, how is AI currently as of today transforming mental health care in this region of ASEAN, whether it's from early detection, whether it's from to intervention, or even improving access? Perhaps we'll start with Dr. Hari.
All right, thank you, Dr. Ginsky. It's a question that needs an hour to reply, but I'll try my best. AI is definitely recreating or creating an impact on the way that mental health is being looked at. But before I talk about that, I need to actually make very clear what mental health is. A lot of people talk about mental health in the context of mental illness, but mental health is actually a continuum. So you have mental health, you have mental health issues, you have mental health crisis, and you have mental disorders or mental illnesses. So the current understanding of mental health, I think, needs to be corrected first, so that the development of AI can actually cater for the continuum, for the needs of the individuals seeking for and using AI in the ways that in the way that's needed. And I think AI also, I think we need to look at ASEAN in general. When we talk about mental health and mental illness, different cultures, different societies express or understand mental illness differently. The way they express, the way the culture provides support, and the stigma associated with mental illness actually has to be looked into. So at the end of the day, there cannot be an AI that fits everyone. You need to look into the psychosocial, the cultural variables that can make AI useful. But we cannot deny the fact that AI is helping, is making mental health support or psychosocial support accessible. Because in Malaysia alone, for instance, you only have about 460 plus, below 500 psychiatrists and about 400 clinical psychologists. And especially during COVID-19, when I was leading Mercy Malaysia's team to provide psychosocial support to Malaysians, we find out that not everyone has access to mental health support. So using helpline and hotlines at that particular point in time was very useful. So people could talk about the anxiety, people could talk about the worries and fears that they had. But I feel that we need to actually make sure that the AI developed for ASEAN needs to take into account the cultural variables, into account practices, beliefs, faiths, because these variables can also, act as preventive measures as well as treatment options for people with mental health issues, ranging from mental health issues to mental disorders. So we have many people who are intelligent in this region. I think we can sit down, but I think we need to actually do the needs assessment and gaps assessment thoroughly before we can be very confident that AI can be impactful in the long run for everyone in the region. Thank you.
Thank you, Dr. Hari. That's such an important point. So I'm a medical doctor by profession, master's in public health, and I'm co-founder of Angsana Health. What we deal a lot on a daily basis is to make healthcare local, make healthcare contextual to the local community, and we cannot just import whatever that is from the West, for example. This is a for lack of a better word, the white people solution, right? It cannot be imported directly into this region because of the different culture. And I think Dr. Hari brought up a very, very important point. Even if AI exists today for mental health, whether it's for early detection or for intervention, it has to be contextualized to the local culture. And I will turn to Dr. Jack to share more about this region and the research that he's done around mental health and AI, and then we'll turn to Rina to talk about reproductive health as well. Dr. Jack, over to you.
Right, thank you, Dr. Ginsky. Yeah, AI is with us. Yeah, nowadays it is very important. Yeah, so to my opinion, so I've listed down based on my recent studies. Yeah, on the transforming mental health in ASEAN. Yeah, especially. Yeah, there are few key things that how AI can detect, yeah, and improve the access, yeah, in healthcare, mental health especially. Number one, AI-powered chatbot, yeah, and mental health apps that are providing 24/7 support, especially in areas with limited access, yeah, to train professionals and healthcare providers. Yeah. Secondly, machine learning algorithm, yeah, it can detect early sign of stress, anxiety, or depression through speech patterns, typing behavior, and wearable health data. Okay, next, telepsychiatry platforms with AI Triage helps prioritize urgent cases and reducing waiting time. Okay, next, language translation tools, yeah, that can allow mental health support to reach diverse linguistic communities across ASEAN. Lastly, data-driven insights enable targeted outreach for at-risk groups. Yeah, for example, youth and rural populations. Yeah, that's how it transform mental health. Yeah, yeah. Thank you.
Thank you, Dr. Jack. Such wonderful ideas that we have, right? Imagine you can chat with a chatbot, and that chatbot can help you identify what are the feelings that you cannot process inside, and then help you to express your feelings in a healthy way. Of course, these are very idealistic. And later, after Rina shares about how what is the potential of AI in reproductive health and mental health in general, we'll turn to Dr. John because he's a practicing counselor. He will share more about how will it not work for a chatbot, for example, that Dr. Jack has shared based on his practice. What are the pitfalls in using AI to help with patients, with people with mental health conditions? So let's turn to Rina first to share about her views as a founding CEO of a reproductive health startup to talk about AI and mental health. Over to you, Rina.
Thank you so much, Dr. Ginsky. So, when when we venture into reproductive health, it's a topic that's highly culturally stigmatized and taboo. And if you bring in mental health into the equation, it's two plus two, right? And we wanted to venture into this because we see a huge gap of people not seeking care when they need to, not taking action, not taking interventions, and that's where Pistol was born. I ventured into this and essentially develop a ecosystem, or what you call like a simple marketplace, to connect traditional healthcare providers to users in a tech and digital way. And in this way, we are able to impact probably the whole of ASEAN or even Malaysia. We are starting with Malaysia, but hopefully to expand to ASEAN to really provide that accessibility. And when you talk about accessibility, um, what does that look like? You talk about cultural nuances and localization in each of these different countries. There's language, there's even this, I would say, practices, cultural practices that are very local to each ASEAN country, right? If you talk about Malaysia, for instance, and we cover topics like STDs or contraceptives, for instance, is something that we don't talk about often. And you talk about reproductive health or sexual health education is something that is quite left behind, and we do need to bring up these issues because it's part of everyone's daily lives. So for mental health anyway, one of the solutions that we're looking to solve is specifically in the use case for postpartum depression and domestic abuse patients, right? We're seeing a high level of patients that are affected, suicide rates that affect families, right? And and that's where we come into the picture. And as for how AI is transforming mental health, I think I would stress a little bit more on the cultural nuances. When you talk about language barriers, you talk about accessibility. What does accessibility look like? Is it just a tech uh, platform that means that if you have a smartphone means you can access it? That's one element. But the other element is language, culture, and even affordability. Um, if I put it to terms, having a physical therapist would be very expensive to the mass population, right? It's not necessarily accessible. When you talk about 24/7, when you have that panic attack, when you got that stress, right? And these bots or AI bots or AI tools in mental health can instantly um, support you when you need it the most, or give you that kind of like triggers to help calm you down and put you in place, right? And this could save a lot of lives, and so that's where I see the real benefit of AI in mental health spaces. But of course, I'm sure we'll dive into the cons and also the concerns around AI and mental health, because at the end of the day, it's healthcare and it's people's lives that we have in place in our hands and in these tools as well. Thank you.
Thank you, Rina. So right now we are going to dive deep into what happens on a daily basis, okay, from a perspective of a counselor. Dr. John, the prompt is, now that we have seen what are the potential that AI can do, right? Uh, let's talk about, do you think it's applicable in a daily life as a counselor when you talk to patients?
Okay, so I think that's a very good question. Thank you, Ginsky. Um, I want to start by first, like maybe what I can do is probably present to you what exactly AI does, and then you can judge for yourself whether you think it's applicable or not. But before that, I also want to agree with the panelists as well on their theme of there's very much the theme of the importance of the cultural context and also context sensitivity, right? I think to take this one step further, we need to understand how AI actually works, right? Especially these large language models. What it does is that it's as good as the data that you feed it. So the AI works as well as the data that is used to train the AI. Now, this is fundamentally also a problem of equality of access, right? If you have a large language model, and if most of the data comes from developing worlds, right, or developing countries, or even within the same group, right, within the same demographics, for instance, there are studies that show that male and female, men and women, they tend to use AI differently, and there is less access to women, right? There's a number of factors for that, but the problem with this is that when there is less data, the AI tends to be biased towards one group or the other, right? And then automatically this presents an issue with the solution itself, because when your AI is biased, then your AI counselor also becomes biased. Yeah, so I think that's the culture sensitivity component is very very important. In terms of how AI is used, I think I would divide it. I think probably Dr. Jack I think provided a good, somewhat of a good descriptive breakdown. I would divide it into three groups essentially. So there's one, the first part is interventive, which is AI as intervention. This is where, as a user, you communicate with the AI and the AI helps you directly. So that's interventive. The second one is assistive, right? So this is where the AI acts as an assistant to the actual professional. Yeah. So it would sort of help you with the diagnosis and so on, but it provides you information. The end decision making is done by the professional itself. So that's one. I think the third one is in terms of AI as analytics. So this is more of how it can act in terms of its predictive technology model in some sense, right? So the interesting thing is that it could actually use data from your smartphones, for instance, your digital phenotypes. So this is like how fast you're typing on your phone, things like your heart rate, for instance, for those of you who are wearing wearables. All these data can be fed into AI, and it could be used to predict whether or not you're going to have a breakdown. And this has been used, I think, in Singapore, IMH, Institute of Mental Health. They have used it for schizophrenia, for instance, and depression as well. But going into the preventive space or the, prior to it becoming a mental illness, of course, then you have things like chatbot, which is more interventive. So I think it's important to have like a framework of how AI is being used, and then to understand what drives the limitation, which is fundamentally access to data. If access to data is limited only to a certain group of people, then your AI also becomes, in some sense, limited in that sense. So yeah, I think that's probably important for us to know. Especially, I think a lot of you are probably in the field. So as you are doing your jobs in whatever space that you're in, it's important to ask yourself: is there equality of access or not? Because that's going to determine how AI is developed in the long run as well. Yeah.
Wonderful. Thank you, Dr. John. Uh, Very, very good insight that you've displayed to us on the use cases of AI, as well as now you've got us, me, all of us wondering, is AI a good application? Is mental health a good application for AI? And we will turn to Dr. Hari shortly. We will turn to her experience in Mercy for a while to talk about. Let's imagine the use case of COVID. We all went through COVID together, and there were many, there were rise in mental health cases throughout that 3 years of multiple MCOs. Could could we have used AI if we have what we have today? Could we have used AI in mental health crisis during the pandemic, and how would that look like, Dr. Hari, if I may?
It's a very difficult question to answer because I don't have the data from COVID itself, yeah. However, the impression was that um, when again looking at the definition of mental health, AI can be useful as the first line of support. All right, so in a crisis situation, we provide the first line support called psychological first aid. So it's not about treatment, it's not about intervention, it's not about psychotherapy. It's about being able to, just like a plaster that you use when you're physically wounded, it is actually a tool or an approach to ensure that people who do have coping skills, who do have the knowledge to be able to mobilize the appropriate coping skills to deal with the crisis situations. So it actually acts as a preventive measure from the normal stresses or the expected distress from facing a crisis into developing something more serious. So it could have been very useful in that situation. So what happened during COVID was, like, when we immediately were able to actually collaborate with Ministry of Health, we had to gather a group of psychologists, volunteers, and train them in psychological first aid, and then provide them online. But you could, and we did. I'm sure we did miss a lot of people, some groups of people who could have benefited from the psychological support at the first line of support. And I think it's very important that we realize that once that happens, there has to be a referral pathway. AI needs to be able to actually have a system built in to know whom to refer these patients to. It could be a medical doctor, it can be a counselor, it can be a psychiatrist or a clinical psychologist. So I also believe that, I'm not sure, we talk about screening. I'm okay with screening, but when it comes to diagnostic assessment, AI has to work with a physical trained specialist to be able to do that. Psychologists now are struggling with whom we call pseudo-psychologists, people who claim themselves to be able to do or provide mental health support, but they're not trained to actually do the clinical assessment, make the diagnosis, and plan for a treatment for the patient, specifically catered for their mental health issues. So for me, AI can be extremely useful at the first line of support, the psychosocial support. But when we move towards mental health issues, the psychologists have to be in place, and the design of the AI itself also has to be ethical. It has to be person-centered, not just cultural centered. So there's a lot of more questions about how AI can be beneficial in the long run. I feel that it can be beneficial, but before we develop further, there has to be regulatory frameworks. There has to be clinical research being done to actually assess the effectiveness of these AI tools on mental health outcomes long term. There are research now being done, which is wonderful, but clinical trials, just like in medicine, just like in medication, you need to actually make sure that the medication, and that is AI tool, does have a positive impact to the patient through clinical trials. So you need policymakers, you need business people, you need lived experiences, as well as a specialist to be involved in the creation of AI tools. Thank you.
Thank you, Dr. Hari. We're going to turn to Dr. Jack shortly to talk about what are the regulatory frameworks that are needed, or what sort of evidence is needed to prove that an AI is useful for mental health. But before that, before we talk about regulations and evidence with Dr. Jack, we're going to turn to Dr. John first to share a little more about his experience on what could go wrong if we use AI in mental health. Dr. John shared earlier on AI could be used for screening, can be used for analytics, can be used for interventions. I think many of us have this question, what could go wrong? And then we're going to turn to Dr. Jack to talk about how do we ring fence the issue of AI in mental health with evidence and in policy. So and then we're going to turn to Rina to imagine how can we implement the evidence, the what could go wrong part, and what evidence is required, and what policy frameworks are required into reproductive health. So, Dr. John, so I've laid down all these things for you to be prepared, huh? Okay, Dr. John, over to you. What could go wrong in AI in mental health?
Okay, I'll try my best to answer this. It's a very exciting question, because when you ask what could go wrong, the answer with AI is everything could go wrong, and nothing could go wrong as well, right? It's the same with any technology. So I believe when the first automobiles were invented as well, things could go massively wrong. You could literally die, the car could explode, or things could go well and you could have a massive traffic jam, right? So I think it's the same with AI. I think it's a matter of how it is applied, where it is applied, and what are the systems within which it is placed, right? You would want to place your AI within human-led systems, which means that the human is the ultimate arbiter or the ultimate person that makes the decision of whether or not something goes or not, right? You don't want the AI to take on a primarily decision-making role. You want it to give you the information so that you can make certain decisions. So I'm very much for the assistive component of AI. I think that it could work very well with human beings. And some of the countries, even in ASEAN, I think Singapore being one of the foremost ones, have already applied this even from a policy perspective and from an actual applications perspective. So you actually see, for instance, MindLine in Singapore, right? They have a chatbot. And literally, I think they boast about 15% of the 3 million target within this year, within the first 3 years or something like that, of usage in that sense, right? So I think that when it comes, particularly when it comes to policy space, I think it's important for us to consider everything that could go wrong and then to ask ourselves, even if everything goes wrong, is this something that we want to throw away in that sense? And I don't think so. So for me personally, I'm very much for AI in a lot of ways, but I also think that if we want to avoid the pitfalls, we need to place it together with a human being in order for it to function effectively. Now, as to answer your question directly, what are some of the things that could go wrong, right? I think what I mentioned earlier in terms of access to data, if your AI is not trained with culture-sensitive data, it could give you information that is harmful. Yeah, so for example, the culture, for instance, in countries like America, the global north, and countries like Malaysia could be very, very different. And certain advice or certain suggestions that is given could also differ quite widely. And you don't want, at the end of the day, right, imagine this, right? Imagine speaking to a counselor or a therapist and that only causing you further distress. Now, the AI could also do that for you if you give it all the wrong data to work with. So I think that's one. The second is when you have, so there's two parts to this. One is the lack of trust towards AI, which prevents people from actually using it. But there's also the opposite, where you trust AI too much, right? You see this especially in students, right? It's quite a big deal. You have the entire assessment or assignment done through ChatGPT, and they even forget to check for hallucinations, right? So you've got sources that don't exist coming out. So this is the extreme trust, right? So now imagine if you put that in practice, you would have the AI giving you information that largely does not exist, and then you trust it, right? And this is difficult because if you think about it, not everyone is an expert in AI, right? And because not everyone is an expert, at the end of the day, legitimacy is important in some sense because you trust authority because you believe that they are trustable, right? So we want to avoid AI from becoming that authority, but we also want to integrate AI within the authoritative frameworks so that it's able to function effectively. So yeah, I'm not sure if that answers as much. I'm trying to avoid too much details, but I'm trying to like look at the bigger picture in some sense. So hopefully that helps.
Thank you. A very interesting example that Dr. John brought up, cars, right? If let's say I drive a car and the car breaks down, I will not sue the manufacturer. If I use any laptop, computer, if it breaks down, I just bring it to repair, right? Not so with AI and mental health, because mental health, if not handled properly, can cause death. And in fact, we know of cases in the US where a young adult or a student who chats with the AI every day and ends up committing suicide. These are the very unfortunate scenarios that happen when we depend on AI. I would say too much in this case. Of course, the AI was not meant for mental health, but in this case, the boy used it for his own mental health, and that's why it happened. But in cases where clinicians, for example, they use AI to help patients with mental health, if something goes wrong, who gets the blame, right? We cannot sue the AI manufacturer or the AI programmer because they would have stated their disclaimer that this is not meant for mental health use, and even if they are brave enough to state that, they must have had evidence, which we will turn to Dr. Jack shortly to share more about what sort of evidence we're looking for. But I think as of today, the AI is not good enough for our mental health. So let's try and get there. Let's try and use AI so that we can solve the issues with access that Dr. Hari was sharing earlier. Um, People not having enough not having enough people that are trained in psychological first aid now can access mental health support because of AI, but still evidence is required. So let's turn to Dr. Jack. What sort of evidence do you think we should look for as researchers, as academicians, as industry manufacturers of AI, programmers of AI? What sort of evidence should we look for?
Right, thank you, Dr. Ginsky. Yeah, as a researcher, I have highlighted a few things, especially on the data protection. Yeah, so number one, strict adherence of to the data privacy. Yeah, such as Malaysia PDPA is very important. Yeah, and also relevant ASEAN's regulations. Right. Secondly, clear consent processes explaining data collection and storage and so on. Yeah. Thirdly, anonymization of data. Yeah, it is very important to prevent identification of the users. Yeah, and also regular security audits is to be carried out. Yeah, to prevent all these and protect data protection. Yeah, all these and also transparency on AI algorithm. Yeah, in terms of decision making process to avoid bias. Yeah, bias especially, and also discrimination. Yeah, these are the data protection things that we can do. Yeah, to um, to prevent. Yeah, and also to use AI for sensitive. Yeah, health mental issue. Yeah, so on top of that, so I have come up with few listing. Yeah, how to build public trust, yeah, especially in using mental health in AI, yeah. Number one, we can share stories, yeah, success story with our the users, yeah, how AI can improve, yeah, without replacing human care. This is very important. Secondly, involve mental health professional in the design, yeah, in the design and also delivery of AI tools. This is important as well. Number three, provide free trials or community demos so that people can experience AI, yeah, in using AI, especially in support side, yeah, for the first hand. And then next, to address fear, yeah, to address fear, acknowledge the limitation of using AI. This is very important. And lastly, probably you can collaborate with NGO, communities, and so on, so that we can get endorsement of using AI. Yeah? That's what I think that could help to build public trust and also the usage of AI. Yeah, thank you. Over to you, Dr. Ginsky.
Thank you, Dr. Jack. That's a black hole in itself to talk about data privacy in AI, and then there's a transparency of AI algorithm, and very very important that Dr. Jack brought up about public trust. I want to turn to Rina shortly to talk about. In the field of reproductive health, you mentioned postpartum depression. Let's say we get enough evidence and we have enough transparency on how the AI works. Do you think mothers will accept using AI to support their mental health? But before we go there, we have about 6 minutes left. Unfortunately, we're not able to run through all the important questions that some of you have asked. After Rina shares about her thoughts, I'd like to invite the floor if there are any questions at all that is relevant to AI and mental health, and we will have the panelists respond to that. Before your Q&A, let's turn to Rina. If we have enough evidence, if we have enough policy framework, if we have enough data privacy and AI algorithm transparency, do you think mothers will trust in AI? Or in other words, how can we increase public trust in reproductive health?
So there's two flip sides of the coin. I think one of the panelists shared earlier about trust, and trust, there's two sides. One aspect you see over trust, over compensating, over reliance on AI to almost as a companion, because again it's 24/7, it's always there for you, and it always gives you all the that feel good factor after you discuss with it, when you talk with it, right? And then you have the non-trust, and I think that this really applies to physical therapists, right? When you see a patient and you talk to them, it takes a while, a few sessions for you to, uncover that, trust therapist and then be able to really share what you truly feel, right? But with AI, you feel that like, oh, there's no judgment there, right? And so I think it's more on the fact that people are over trusting AI. And if you talk about regulatory frameworks in the US, they have HIPAA laws and also clinicians that put in certain bylaws to navigate and also to manage these platforms, which I think could be a potential application here in Malaysia. And as for for mothers, especially young mothers, we're seeing is even in recent years globally. In Malaysia, the last few numbers was 25% of young people committing suicide, right? And if we were to measure that against the implications of how AI could also have a negative nuance or effect, um, is really losing 25% of your population, your life, valid to solving this problem? I would think yes. And as for mothers, they are bringing new life into the world. And a lot of the times it's a very lonely journey, right? And at the same time stigmatized. To talk about it with your family, to talk about it with your husband or anyone for that matter, you would think that like, oh, you might think I'm crazy, right? And I might not be you might take my baby away, for instance, right? And that's a very real thing. So, but what's the protective measures that we have for mothers if they do share all these like fears, right? Even with a physical therapist, how are they protected, right? Because right now, majority of us, I would say, are not really going to clinicians. They're relying on AI bots or tools, these tools that can give them that instant fix, that instant like response that typical therapists don't have. Like if you have an attack right now, are you gonna be able to call your therapist right now and say, hey, I need help? You probably have to wait for your session on Friday at 5 o'clock, or have to wait a few days before I can address this, right? And it might be too late. So I think in that aspect, yes, there's a definite positive aspect. Of course, we do need to regulate it. Of course, we need to take steps and measures to make sure that people's privacies are protected, and at the same time, not over compensating or overusing AI as almost as a companion, right? And I guess stepping away from the world.
Yeah.
Thank you.
Thank you so much, Rina. What a wonderful elaboration on that. So, in favor of time, we've only managed to talk about probably the tip of the iceberg of how AI and mental health can help the community and the public. I'd like to take a question from the floor, if any at all. Perhaps. Oh, okay, we have one already. Okay. Yep. Thank you. No. No. Okay. Nope. Oh. Okay.
Thank you. Um, I have two questions actually, so I'll just try and put it in one. Is there any initiatives that are already done by the government or any known organizations on how we can ensure that the safety of using AI for mental health is somewhat regulated? Since all the conversations are going around once people are not going to clinics and they're using AI like you mentioned just now, and there's also what Dr. Hari mentioned about making sure that there are preventive measures, and how do you make it safe enough that they don't use the AI for mental health and end up misusing it? Yeah. Thank you.
Sorry, the second question? Or that's it?
How can we ensure AI in mental health is developed with strong ethical safeguards and paired with public and professional education to prevent misuse and harm? And is there already an initiative or government policy addressing that?
Thank you for the wonderful question. Firstly, none of us here will speak on behalf of the government. We don't represent the government. But if anyone would like to share?
Yeah, I think I can take part of that question. I'm going to sidestep the policy part. I'll leave that for the rest. in terms of how do you develop secure systems, right? In terms of AI, I think the fundamental is that you need to develop the solution with the person that you are serving. So it has to be a co-development with the person. So most of the time what happens is that it's always done from a very commercial perspective. It's done from a top-down way, and it doesn't reach the people that you're actually serving. You don't have data from the people that you're serving. In an ideal world, what you want to do is to co-develop the solution with, so you want to actually go down to the ground, speak to the people that you're going to serve, and get data from them, right? Ideally, you want the AI to work with the data from that population. And also there's this theory in social science, I can't remember what it's called, but essentially the best solutions come when you develop it for the ones who would have the least access to it, right? So if you could actually target the people who have least access to it, the poorest of the poor, you would actually have technology that works the best because you're actually taking into account the worst case scenarios, right? So I think that's something important when it comes to how do you develop systems that are safe, systems that are human-centric, and systems that are centered on the people that you're serving. So I think that's the general thought. I'll pass it to the rest.
Thank you.
We agree.
Okay,
I
sorry, in favor of time, right, we have to close this session already. I can take part of the question though before we close this. So I'm part of the technical committee with the Ministry of Digital on PDPA for AI. As of now, we are building a framework for personal data protection for AI, not specifically in healthcare. So healthcare has their own 27 laws in Malaysia, if you don't know. We all have the laws that will govern the guiding principles for AI already. So it includes do no harm, it includes who is able to administer such a tool, for example. So there are existing rules already, just not specific to AI in mental health. Even AI in healthcare, that's not there. What the Ministry of Health is building is starting with EHR, Electronic Health Record System, and they are dabbling with AI in it for now. But these are all very low risk. They do not involve screening or caring for patients directly. They are only within making sure the records are safe, the records are good, and so on. So we are a long way from having AI being regulated in healthcare. Secondly, strong ethical safeguards. As with all innovations, this is my opinion. Any innovation has to be industry-led, and they will usually be motivated by the returns of revenue, right? So that's why they are very innovative. Not so the regulations. Regulations will have to catch up after a few years. This is just how things have been so far. So I hope that answers your question. Thank you once again for our esteemed panelists. We've talked about the problems with AI. We talked about the potential of AI improving access in anytime, anywhere. You can see you can get mental health support. We can use it for screening, psychological first aid. But of course, there's problem with transparency of AI algorithm, data privacy, as well as the effectiveness in general. So with that, I hope you enjoyed our session. Please feel free to connect with our panelists offline, and we hope to see you again. Thank you so much.